Welcome to the Sleep On It podcast, brought to you by Aeroflow Sleep. I'm your host, Meagan, and today I'm joined by Dr. Christopher Allen. Affectionately known as Sleep Dr. Chris, he is a board-certified sleep medicine physician and pediatric neurologist, practicing in Saginaw, Michigan. He has received certifications by the American Board of Psychiatry and Neurology with subspecialties in sleep medicine and child neurology, and his focuses include heart health too. All of this is exactly why Dr. Chris makes the perfect guest to speak on what other medical conditions are linked to sleep apnea. So thanks for listening, and let's begin. Hey, Dr. Chris, it's Meagan. How are you doing?
Hey, Meagan, how are you doing? Long time no see.
Wonderful. Yeah, it's always so good to see you. Dr. Christopher Allen is here with us today, and he is somebody near and dear to our hearts. We have been working with him for the past year now. Excellent medical advisor as a part of the Aeroflow Sleep team. And I understand you have a new practice.
Yes, it's just been going on for a month now. We actually last Monday had our opening, our grand opening where we can actually see patients in the office. It's called Quality Sleep and Neurology because, I'm pediatric neurologist, but I also do sleep medicine for kids and adults. And so it's very rewarding, like having people like come in and, I've been telling patients every day, just being very grateful that they're a part of my practice because I tell them I love seeing patients. So the fact that they're deciding to come to my own private practice, it's rewarding, but it's also humbling as well.
But I'm certainly not a doctor, and I want to make that clear that part of the reason why we are interviewing Dr. Kritz today is because I am here as a host, and Dr. Kritz has all of this knowledge to bring to the table because he is a true practicing doctor and medical professional. So what we're going to be talking about today on this episode of the Sleep On It podcast is, are other medical conditions linked to sleep apnea? As I understand it, there are several.
Oh, yeah, definitely. And the thing is with medical conditions and sleep apnea, and I always talk to my friends and colleagues about this, is that not getting that quality sleep and having sleep apnea can affect many things. And, most commonly, especially if you don't have your obstructive sleep apnea treated, it can lead to high blood pressure, it can lead to diabetes, it can even lead to stroke as well. It can make mood worse. And also, if you have other conditions, it can make those conditions worse as well.
Wow, that's really good to know. So even though you already have sleep apnea, whether or not it's being treated, it can worsen all of these conditions that we're talking about.
Most definitely. And even with the American Heart Association dealing with like high blood pressure, and so if you have hypertension and it's being uncontrolled, one of the things they want to look at is to make sure of two things. One, if you have a sleep disorder like obstructive sleep apnea, or two, if you do have obstructive sleep apnea, if it's being adequately treated.
Yeah. And Heart Health Month actually is February, so it's great that we're talking about this right now. It's very timely. Hypertension, also known as high blood pressure, being one we've spoken about a little bit. Tell me about the risks of cardiovascular disease. How are those connected to sleep apnea?
Definitely it can, affect your heart, make high blood pressure worse. Cardiovascular disease, it can also make it worse as well. And the thing is that if you don't get your sleep apnea treated, and I was telling my patient this, what happens at night can affect your daytime. Now, within 1 week, it would not make any, effect on there. But, after time, it can wear on your heart. When you're getting lack of oxygen to your brain, that can overreact. You have stress signals that go throughout your body. You also have your heart working and even being stressed more. Over time, that can make it worse. Over time, those cardiovascular disease can get worse, and it can lead to even worsening disorders as well.
And that's when you start becoming likely to have a heart attack or stroke.
No, definitely. And the thing is that lack of oxygen, the strain on your heart, definitely leads to stroke, definitely can lead to, having a heart attack as well. Unfortunately, I call obstructive sleep apnea, or like or any sleep disorder, especially sleep breathing disorders, the slow killer.
Yeah. Yeah, no, that's really the reality of what you're dealing with when you have sleep apnea, that all of these comorbidities are possible if you don't already have them. Another medical condition that you discussed earlier is diabetes, and that being a big proponent for sleep apnea. Aeroflow is actually under an umbrella called Aeroflow Health, and we have an Aeroflow diabetes division, so we do work with them because of course, the two correlate. So tell me a little bit more about the diabetes side.
Again, if you're treating your diabetes and trying to get that under control, one of the things that providers, and even such as myself, look at being a sleep professional, I make sure that if the patient does have diabetes, is that if they have their sleep apnea treated. And the thing is that one of those stress signals that is increasing within your brain, that can also play a role with like insulin and insulin resistance. And so that's one of the things that I look at as a sleep doctor to make sure that that's under control. And as always, one of the things that you look at, if you're looking at the management of your diabetes, and if it seems like it's not getting control, one of the things that they will look at is to see what are other factors that will play a role in that. And one of those other factors are making sure that your sleep apnea is adequately treated as well.
When you're checking your A1C levels as a diabetic, is there a way to, inform whether or not you have sleep apnea just from that?
So no, if anything, if you look at your A1C and you see that it is rising, that leads you to be susceptible to see if you are a candidate for having diabetes. And so when you do have diabetes, some of the questions are, especially if you're dealing with like type 2 diabetes, it's like, okay, what are the factors that can make this worse?
Mm-hmm.
And so, and I usually call it the triad from it. So if you have sleep apnea, you can use, you look at if you have diabetes, make sure that's taken care of. Also, and if you look at, your heart health, to make sure that you're not having high blood pressure, to check along with that as well. And so, and those are all three are connected. And I have many patients that, if they do have cardiovascular disease or, hypertension or even diabetes, when they're getting that treated, you start to see improvement with that as well, just getting their sleep disorder treated.
Yeah, when do you recommend getting something like that checked out? Because, I myself am not your stereotypical sleep apnea patient. I am not diagnosed by any means, but I have been diagnosed with pre-diabetes in the past, and I'm on metformin, which kind of regulates that and takes care of that for me, where I am back into the normal range. But I know that there are some people who are probably well beyond that. Where should they begin?
So, and those are the questions, and this is where I always talk to my patients that, following up with your primary provider is very important because that's where they will do those screenings. And so just even if you, so for example, for diabetes, if you see that you're going to the bathroom frequently, if you're frequently thirsty, little things like that, that's like, okay, and you can't account for that. That's when you let your primary provider know, and they will check your A1C levels just to see how susceptible you can be to getting diabetes. Or for example, if you might be pre-diabetic, you can look at those as well. And then also looking at that, you want to look at other symptoms of what's going on. And from my perspective, being as a sleep professional, that's where I'll ask those questions to see if there's a concern for a sleep disorder with their patient, with my patients.
I'm so glad that you brought up the frequency of going to the bathroom at night because that's not one that's often talked about. We actually have a blog that's coming out this weekend that was medically reviewed by Dr. Weiss, another one of our colleagues that I know you have worked with in the past. And it's talking about how high uric acid levels can also lead to an increase in, mortality rate with the heart attack and the stroke and the OSA, obstructive sleep apnea, kind of informing all of that. So yeah, great point to bring up. Because obviously these symptoms are very near and dear to me because like I said, I have pre-diabetes. Mental health is obviously another big medical condition that's linked to sleep apnea. I myself suffer from anxiety and depression, but honestly, who doesn't? The mental health conditions that are linked to sleep apnea, though, what are those? Do those include just your general disorders, or do they go deeper?
Actually goes broad in the classification of sleep disorders. Like there's even when you look at the range of what can affect sleep disorders, we always talk about mood. We always talk about the mood disorders. We talk about depression. We talk about anxiety, but then also bipolar disorder. That's something that's a part of it. So the bottom line is anything that's related to a mood disorder. If you think about mood, one of the things that even if you don't have a mood disorder, how do you feel when you don't get, good sleep? You're crabby. You're upset. Might be a little angry. Someone might call you moody, and it's not any different from someone that actually have a mood disorder. So when you have quality sleep where you're sleeping and waking up, there's no disruption, and your brain and your body's able to recharge, that can help your mood as well. When you have a sleep disorder like obstructive sleep apnea, you are not getting that quality sleep because your sleep is being fragmented. When you're falling asleep, all the muscles relax in your body, your legs, your arms, even the muscles in the back of your throat.
Right.
So like your mouth, and this is the back of your throat. When you're awake, airway's open, air's going in and out, no problem. But when you fall asleep, those muscles relax. And right in the back, it gets small. So when you're sleeping and breathing in, this is the sound people hear. That's how snoring happens.
I love that. That great example.
And it's funny because I will do that with my patients and like their spouse, like, yes, that's it. That's the sound.
I have.
But the thing is that when they're relaxing more in the muscles, all of a sudden airways close. So no oxygen is going to your heart, your lung, or your brain. And the thing is that they don't know what's happening back here. And so that's where it can lead to those other stressors. So your heart's working harder, your lungs are breathing in deeper, your brain is sending stress signals all over your body. Then all of a sudden, you wake up. Well, not you, your body.
Right.
Sometimes you, but then you fall back asleep and it happens over and over and over again. Mm-hmm. And honestly, that's what obstructive sleep apnea is. And when that happens, that's pretty much fragmenting your sleep. It's not letting you getting that consistent, consolidated sleep that you need. And so what happens along with that? You get a lower quality of sleep. Lower quality of sleep, if you have a mood disorder, can actually make that worse.
Yeah.
And if you think about it even prior for patients that will have a sleep disorder and still have that poor quality of sleep, that can actually increase the chances of you actually leading to getting anxiety, leading to you actually getting depression. And, so it works in two different ways because you don't get quality sleep, that can lead to mood disorders. If you have a mood disorder and not getting quality sleep, that makes it worse.
Yeah, no, it's all very serious. I know that we're joking about the sound that comes out of you when you have sleep apnea, but it really does put a weight on you at the end of the day. Some of the most basic symptoms are fatigue and cognition, recognition, not being able to operate a vehicle. Our last podcast guest was Emma Cooksey, and she said she found out that she had sleep apnea because she almost got into a car wreck. It can be very serious.
And it's scary. And that's the thing, not getting that. It definitely leads to a lot of things. And I'm really adamant, and you talk about, being drowsy and driving, to make sure that that can not only affect the patient, it can affect somebody else. That's one of the big reasons why this is really important for me. And then even when we're talking about, mental health, one of the pillars of mental health and even self-care is making sure that you can get quality sleep. And then also giving grace for yourself, because a lot of people hear this, well, you need to get quality sleep. You need to get, 7 hours, anywhere from 7 to 9 hours of sleep. It's like, well, I'm not getting it, but you keep trying to get it, and you involve your provider, because if you're not getting it, then the other question is, why not? Mm-hmm. And so you get your provider involved so you can potentially see a sleep professional to see what we can do to actually investigate it, to see what we can do to help you.
Yeah, because at the end of the day, just saying, get better sleep probably isn't the prescription that we all need to prevent these comorbidities. But how can you really prevent them? If you don't see improvement, how do you find out if you have sleep apnea and can work on it?
That's when you involve your providers to say, hey, I'm not sleeping well. You know, what's, going on? And the best way to even see how you're sleeping, because I tell people the hardest part about my job with me being a sleep doctor, I have to talk to you about things that happen when you're unconscious. And so ask your bed partner because they will sure tell you how you're sleeping. And it's funny because the patients I see when they come in, they usually bring their bed partner because the bed partner is usually will give me better insight on how they're sleeping. So it can be as simple as if you're at home, you're like, well, I don't know how I sleep. Then you're asking your bed partner, like, hey, do I snore? And then just that one question might bring a cascade of answers like, yes, of course you snore. It's loud. Don't you remember me poking you on the side with my elbow and to say, like, turn to the side? Oh, yeah, by the way, you're not breathing and, those things. If you're waking up, because if you're going to sleep and you wake up, you should feel rested. If you don't feel rested, those are one of the other signs that you could have a sleep disorder that's happening.
Yeah.
Also, if you're going to the bathroom frequently overnight, that's another sign for it as well. And so there's some obvious things. There's also some subtle things because say like, well, I don't have a bed partner. I sleep by myself. Well, are you waking up frequently overnight? Or are you going to the bathroom frequently overnight? Little things to see like, wow, I might have a sleep disorder. And then what you do, you go to your provider and they'll help with that investigation. Either they'll go and see if you can get a sleep study to see if that'll happen, or refer you to a sleep professional as myself so we can look into it further.
Absolutely. And on this podcast, we carefully tailored it to say that even though Aeroflow Sleep is providing you with CPAP supplies, we are also truly trying to educate about all sleep and all sleep disorders because at the end of the day, you can have insomnia and still have sleep apnea. So
Yes.
all of these things correlate and kind of go together.
And it's funny because it's all combined.
It
Because
is.
like even with obstructive sleep apnea, there's a combination of where you can have combination of COPD and obstructive sleep
Yes.
apnea as well. And and even having like that together, it helps each other out. Getting your COPD taken care of will help with your obstructive sleep apnea. Treating your obstructive sleep apnea can also help with your COPD.
Yeah.
And
So what is
recognizing
COPD for our listeners who may not know?
so for COPD, it's chronic obstructive pulmonary disease. And so it's a pulmonary disorder where you're not getting air through your lungs where it's been happening for a long period of time. My pulmonology colleagues will usually help along with that. And it's a little bit different from asthma, but you still have problems breathing. It can affect your oxygenation, so the oxygen is getting to your body. Also affect the carbon dioxide because you breathe in oxygen, you breathe out carbon dioxide, and that can actually get higher than what it should from that as well. And the combination of that disorder can also go along with obstructive sleep apnea as well.
Got it. Got
And
it.
so many times when you will see that the pulmonologist will check to see if you do have a sleep disorder such as obstructive sleep apnea as well.
Got it. That all makes perfect sense. And Dr. Kritz, if I remember correctly, you yourself have sleep apnea, right?
Yes, and it's funny because when I see my patients, I always tell them this cheesy commercial. I tell them I'm going to sound like a cheesy commercial, but not only am I your doctor, I have obstructive sleep apnea, and I'm almost going on being treated for 20 years. And so I've got
Wow.
it at a young age and been treated and seen the ways that you can treat obstructive sleep apnea and seeing what it did to me personally being treated and I always think about what my life would be if I didn't have obstructive sleep apnea treated. Because as we talked about, I could have high blood pressure or even worsening high blood pressure or diabetes or even stroke. It affects weight gain as well. It can affect erectile dysfunction. So there's a lot of bad things. And so, yeah, I have obstructive sleep apnea. I think it helps me empathize more with my patients as well because I know how it is.
Yeah, no, 20 years. That's a lot. Even just as a doctor, but also being a patient and being able to communicate with your own patients that way. That's a big deal. So you yourself have been through the testing,
Oh
and
yeah.
clearly you know that treating sleep apnea helps other conditions, as you've experienced yourself. What did that feel like?
Going through it, and it's funny because before I was diagnosed, I wasn't even a doctor yet, and actually I was just in training in class, and there was a lecture about obstructive sleep apnea. They only give it once a year during medical school, and it was like early in my stages, and people were laughing at me. It's like, hey, Chris, that is you. It's like, no, it's not. And
Oh,
so I did a sleep study, and I remember, laying down, and like the techs were looking over me, and I woke up, and they're like, "Yeah, you have it." And I'm like, "Okay." And just even trying CPAP therapy, my initial reaction, I'm like, "What is this?"
yeah.
Because CPAP, for people that don't know, it stands for continuous positive airway pressure, and that last word is the most important part. Pressure. There it goes. Look at that. And so
A lovely
when I was
CPAP
talking,
machine.
yes, and when I was talking earlier, when your airway is closed, that last word is the most important part, pressure. It provides a pressure to keep your airway open. So when I tried that, yes, when you try it, it is something that is not natural to you because you're breathing out and the pressure is coming in. But I did get used to it, but I really didn't notice a difference with it until 3 months in. I was still using it. I'm like, I guess it worked. It was more hindsight because I went on a trip. I didn't take my CPAP with me, and I felt horrible.
How dare
And
you?
yeah, I was
You know
young, yes,
better.
young, and I give myself grace now because feeling horrible, I'm like, why do I feel so bad? And then I thought about it. That was the hindsight moment. Oh, I guess this CPAP actually does work.
And I'm so glad that we're able to help each other. Aeroflow Sleep in particular can help. When Dr. Chris was mentioning those medical equipment providers, that's us. We supply PAP supplies through
Oh, yeah.
insurance. You can get them covered up to 100%. There are options out there. We are willing to work with you, as I know Dr. Chris is willing to work with you.
Oh, yeah, most definitely. And when someone says that they have a problem, I always tell them 4 words. It's like, a guy. And so, like, hey, if you have a problem, and just also, it's like, because knowledge is power. And
Yeah.
shameless plug, because I also have not only being a sleep doctor, also a sleep influencer. So if you go out on social media, look up Sleep Dr. Chris, especially on Instagram, I throw videos out there to tell people like this is what you need to do to get quality sleep, and to look at that, to just ask the question like, what's going on? What can we do to make sure that we can get that quality sleep?
Yes, definitely check out Sleep Dr. Chris on Instagram. And this is certainly not the last time that you'll hear from him or see from him at Aeroflow Sleep. But we are out of time. So, Dr. Chris, thank you so much for joining us today. And I hope that everybody enjoyed it.
Meagan, it's always a pleasure. So thanks for having me, and I can't wait till next time.
Yep. Thank you. Have a wonderful day.
Hey, you too as well.